Hey there, Chris Westfall here. So you're considering a Medicare Advantage plan. How do you find the best Medicare Advantage plan to go on to? What is it that you should be looking for? That's exactly what I'm going to go over today. First of all, I'm an insurance agent, but I have to let you know we don't represent every single plan in the United States. It'd pretty much be impossible to do so. So Medicare makes us put this disclosure on our website. I figured I'd throw it up right there. You could get all the, now this is interesting. There's a news story showing on all the news channels. It's a commercial by Medicare today, and it says, it's open enrollment period. You must contact Medicare to see all your health plan options. And it's actually a lie, because Medicare themselves cannot show you or sell you Medicare supplement plans. Interesting, huh? Medicare supplements, you see, are mandated through the states and regulated through the states and not through the federal government. So you can call Medicare all you want to, but this statement is not true. You can't go through Medicare to get a Medicare supplement plan, and you don't have to do something during the annual election period. They just want everybody to be on a Medicare Advantage plan and want you to think that there's no other plan around. We'll go through that in just a minute. But let's say you are going to get a Medicare Advantage plan. What is it that you need to look for? What are the considerations for that? First of all, the network of providers. Are all of your providers in their network? Now, using easy tools online like ours, MedicareAdvantageNearMe.com. It's pretty catchy, isn't it? MedicareAdvantageNearMe.com. You can either do one or two things there. You can, one, go through our tool directly and look at the Medicare Advantage plans, putting in your own information about your providers. It's a little cold today. It's where I'm at jacket in South Carolina. Or you can ask for help, and an agent can help you with looking at what's in the network, what's not in the network. Now, understand networks change on Medicare Advantage plans. These are proprietary things, so they don't necessarily tell you when their network is going to change, when your provider's contract is up, but they are subject to change, and they do change throughout the year. We bring you from time to time news stories on major hospital networks that drop out of networks for Medicare Advantage plans. So you must look in the network online. If by the time you'd get a book printed out, it's already too late. It's probably out of print already, and whatever you sign up for during the annual election period of October through December may again be changed by the time you get in there in January. Good news is, as I'll share with you in a minute, there's another period of time after the end of the year where you can make yet another change if you have something like this that happens to you. But first of all, first and foremost, look at doctors, look at hospitals, ambulatory centers, outpatient surgery centers, things like that. Secondly, what type of plan are you looking at in the first place? The HMOs will tend to be zero premium. More than 73% of them are all zero premium Medicare Advantage HMO plans across the country. It means there are more restrictions, that you must go through their network. We'll talk more about networks in just a second as it pertains to local or national plans. But if you go to a PPO, that's a preferred provider organization, you have both a network, typically, that you can get better deals on, lower copays, lower maximum out of pocket, and then they have an out-of-network option. I have found in my experience that if you have an out-of-network option, you're able to go to a non-network provider. Typically, the facilities will accept your PPO, but doctors that are not in the network many times will not. See, the plans and the salespeople will tell you, if it's a PPO, you can go anywhere you want to, just like a Medicare supplement, if you already know the knowledge of good and evil and you know that there's a difference in Medicare supplement. They'll say the good thing is you can go out of the network. What they won't tell you is the doctor must agree to accept the payment schedule for the Advantage plan, and he's already chosen not to be a part of it. But he would have to accept the payment schedule for the PPO plan and bill them on your behalf and file a manual claim just for you. That's not very likely on a PPO plan. Could it happen? Yes. If the doctor that you love is not in a PPO plan, you'd better get with them ahead of time and say, I'm considering joining this Medicare Advantage plan. You are not in the network now, but would you at least see me as a patient and agree to bill the health plan if I join that plan? So PPO at least gives you an option to go out of the network. That's critically important if you're going to consider going to a hospital that is not currently in your network. It just gives you some more options to have a PPO as opposed to an HMO. But if an HMO has everything that you want in it, go for it. Monthly premium. I put this kind of low on the list because it is lower on the list. Some of the plans do charge for a monthly premium to be on their HMO or their PPO. The number is getting smaller every day, but we had somebody a few weeks ago who was paying almost $200 a month to be on a Medicare Advantage plan. We could find them a cheaper Medicare supplement plan with no network restrictions, no doctors, no referrals, necessary, no prior authorization, and the like. So that's the difference. You need to factor in the premium. If you're going to pay a premium for a Medicare Advantage plan, there's probably one near you that does not have a premium, but you need to look at these other factors too. There's just one small factor in there. And what are the copays for the doctor and the hospital? Look also at the copays for rehab. If you have a major thing happen in the hospital, yes, it could be $200, $300, $400, $500 a day. And that's why we say you should get a hospital indemnity plan that can pay those for you when you're considering a Medicare Advantage plan. And yes, we have those. But what are the hospital costs, and what are the costs for coming home from the hospital? If you have to have somebody come into your house and take care of you, what does that cost you? And if you have to do it 10 or 15 times in rehab, physical therapy, rehab after a hospital stay, what could that potentially cost you? That could be pretty significant. And if the slide go to the next one, I can show you the rest of them. Max out of pocket. We talked recently about the max out of pocket. This is a huge topic that hides a lot within it. As a matter of fact, I got a news story published in a nationwide publication about this just this week. On the max out of pocket, here are things that do apply to the max out of pocket, and that's after which you don't have to pay any more for the calendar year. Not forever, just for the calendar year. So if you get sick in October, November, you run up your bills, you go in the hospital, you may hit the max out of pocket. That's fantastic. However, when January starts, you have to do that whole max out of pocket thing again. Now, hospital charges, they do apply. They'll go toward your max out of pocket. Doctor copays, they'll go toward your max out of pocket. What most people are surprised by, however, is that the prescription drugs that you pay within a built-in plan, that is your prescription drug plan is rolled into your Medicare Advantage, they do not go toward your maximum out of pocket. You have to look at that very carefully. Denied services, and you go out there and decide to pay for those services out of your own pocket, like many people do with cancer treatment on Medicare Advantage plans, they're not going to reimburse you on that if it's out of their network, and it does not go toward your max out of pocket. You don't get credit for that whatsoever. And if they fail to give you prior authorization to have a surgery done and you go ahead and do it anyway, that is not going to be reimbursed, and it's not going to go toward your max out of pocket. You need to know that up front, and most people won't tell you that. So medication costs is another factor in considering your Medicare Advantage plan. Most people are lured in, there's study after study that shows this, based on the freebies that they give away, the over-the-counter benefit, the money that they give you for Band-Aids and things like that, the dental benefit, the vision benefit we'll talk about. They're lured in from that, and they totally forget their medication plan, their Part D, is just rolled in there. You better look hard at that. That's why with our tool, you can put in your medications at MedicareAdvantageNearMe.com. You can put in your medications, and you can see how the different plans are going to cost you at the end of the year. And with that tool and our other tool, which is StartPartD.com, if you're just shopping for a standalone drug plan to complement your Medicare supplement, on both of those tools, the most important thing to look at is the total cost per year. I recently did a video about WellCare's new plan that in many parts of the country has a zero monthly premium plan, or 50 cents a month or 40 cents a month. Look carefully only at the total cost at the end of the year. Now, if you take no drugs or you only take generic drugs, it may be fantastic to look just at the monthly premium. But I encourage you, and that's what our tool does by default, is look at the total cost. It factors in your monthly costs on the premium, your copays when you're at the pharmacy, your co-insurances when you're reaching those higher tiers, and the deductible if it applies and when. All that's factored in. Just look at the total cost. Save you a lot of time. But many people on Medicare Advantage completely forget at the medication. The star ratings with CMS, there's been a flurry of activity in the last couple of weeks with the insurance companies writing to us, the agents, and saying, our ratings went up. Aetna's really happy about that. Humana's happy about that. Got great ratings in many parts of the country. It depends on where you are. You should look at the star ratings, but some of them, there was one company this past week that just got sanctioned by Medicare for having ratings too low, and they won't be a part of the program next year. You have to look at the star ratings. If it's less than 3 stars and they stay that way, they will be kicked out of the Medicare program. And one of those star attributes, the most important one to me, is customer service. How happy are the people that they're serving? If you have a 2.5-star program, a 2-star program, a 1.5-star program, I would highly recommend you to be very suspect of that program and not even consider them. That's my opinion. Nationwide reach. Does your plan have a national name? Is your doctor going to recognize that name? Or did they just get started and they're only a local HMO run by a local hospital system? If they are a local HMO run by a local hospital system and you never leave town, you never travel, that's not a big consideration for you, no problem. Then you should really consider that. If, however, you do travel, there are certain advantage plans that even though they're an HMO, they will grandfather you in and allow you to use their network throughout the country. That's fascinating. And that's a really good benefit. So does your advantage plan that you're looking at have a national reach, or are they just local? That could be a problem. Over-the-counter benefits. These are one of the things that they use, the flash in the pan, to sizzle on the steak, to bring you in and get you in a plan. There are even some of the plans now are paying for your air conditioning bill. They're paying for food if you get out of the hospital. They're paying some of your utilities. They're giving you, there's one plan literally last year was giving a robot dog so that you don't feel lonely in your home. So you have to consider these over-the-counter benefits, but the reason why I put them so far down on this priority list is because they really need to be down there. They can be taken away at any time. That what they're doing here is they're usually using some of the money that Medicare pays them over and above what Medicare costs to run, and they're luring you in with these benefits by giving you some freebies out there. And they're trying to get really, really creative with how much they can give money back in a sizzle kind of a way to lure you into the plan. Just understand, these plans change every single year, and what you see on your plan this year will not necessarily be on that same plan next year. You also have to look at the very small print. If you don't use that benefit this month, will it roll into next month? Do you have a certain time frame? Do you have a certain provider that you have to go through to get those benefits? Then dental benefits. Many of the plans are just rudimentary only. They're just preventive. You can go for a cleaning, 2 cleanings a year. Everything else you can get a discount on, but it's not a true comprehensive dental plan. Many times these Medicare Advantage companies will say, we've got dental, so you can check the box and say, we've got dental. Please look closely. What is covered? What major services are covered, and what are the restrictions? Some of the plans allow you to go to any doctor. We just went to one orientation a couple of weeks ago, a new plan in South Carolina. Fantastic, and go to any provider you want to for your dental services. I think that's great. Most, however, are just like the HMO part, where you have to go into their restrictive network and they pay for the cheapest dentist to be a part of it. And again, they only pay for basic dental just to say that they have dental. And then vision benefits, same thing. Is it really money toward glasses or contacts? Or is it just saying you have a benefit if you go to a certain provider and it's a certain discount? Look at the small print. I encourage you. One of the biggest things about Medicare Advantage that agents don't talk about is prior authorization. How big a deal is this? It's huge. Let me show you what doctors think about prior authorization. Remember, this is only a function of Medicare Advantage. If you have a Medicare supplement, you don't have prior authorization.
Authorization is a nightmare.
It cripples my patients. It cripples my medical practice.
It takes a lot of the joy out of medicine.
So the amount of time that it takes myself and my office staff to go through that process now for almost every prescription we write has gotten to be an enormous problem, both for us and for our patients. They're spending something like 15 hours a week per physician just filling out these forms and waiting on hold for the insurance companies.
Dealing with prior authorization is just a disaster, both for physicians, but more so for the patients. They're put in situations where they're not sure whether they're going to get their medication. They're not sure whether they're going to be able to have a test.
It takes time away from other patients. It frustrates physicians endlessly. I would hope that patients would recognize that doctors and patients are really on the same team, that we are as frustrated with this as they are. This is a great opportunity for patients and physicians to work together.
From the AMA standpoint, we've done a lot of different things. First thing is we pulled in health insurance plans to try and build some consensus. We also think that there are specific physicians who consistently follow evidence-based guidelines, are taking great care of their patients. Their prior auths are always getting approved. Could they maybe be gold carded? Another thing that's important to us is being able to know right there with the patient in front of us at the time that we're talking about treatment options, what things a health plan is going to cover. So we're pushing very hard for transparency right at the point of care so that we can make a choice that's going to get them a medication that they can get quickly.
At the end of the day, this is about the patients. This isn't about the fact that I spend hours every week dealing with this. It's not about that. It's about the fact that I could see 10 more patients during that time. It's about the fact that the patient that I did see wasn't able to get his medication and it caused his disease to worsen. If legislators and other stakeholders were to learn from these patients directly, I think that's what's going to be the most eye-opening.
If patients are willing to even just sign our petition at fixpriorauth.org to tell Congress that they're working with the American Medical Association to fix this problem, that goes a long way toward helping us make some progress.
It is a big problem, and it's only Medicare Advantage. If you have a Medicare supplement plan, again, you don't have that problem, or original Medicare. The other big thing that you need to know about with regard to Medicare Advantage is cancer. Look very carefully at your summary of benefits. Sometimes it's a one-page into what you just normally see from the sales pitch. Again, you can see that at our page called MedicareAdvantageNearMe.com. And you can go in there and look at the summary of benefits. How do they treat chemotherapy? How do they treat radiation? In most all cases, they're going to charge you, the patient, 20% of the cost, the entire cost. So yes, you'll hit your max out of pocket, and you could very possibly hit it twice. How? You start your treatment in November, December, and you have to roll that again January, February. So always look at saving in a piggy bank jar twice your max out of pocket. That's the best possible advice I can give you. Remember, your max out of pocket, though, does not apply if you go get treatment somewhere and it's not been approved by your HMO or your Medicare Advantage plan. How do you solve that? We solve that with our Medicare Advantage clients by recommending that they get a lump sum cancer policy. It's very inexpensive, and you could have $10,000, $20,000, up to $50,000 set aside with a very small monthly premium so that you can pay for cancer treatment. You can pay for your co-payments. You can go to places that you could not go to otherwise on your Medicare Advantage plan. You can pay someone in your family to come stay with you while you're going through the pain and agony of certain types of treatments. I think it's important that you have choices. And the first time a Medicare Advantage plan says you've got to get prior authorization before you have that test first, before you have that prior authorization, before you have that treatment second, here's what happened to one of my clients. Please listen very carefully to Joel's story.
Well, I've seen some of your videos, and they're extremely informative and very clear-cut.
Thank you very
much. I wanted to thank you. I wasn't actually expecting that you were going to call me back, but I thought since I had the opportunity, I would let you know. The other thing is I wanted to tell you a little story as part of all of this. They needed to schedule a PET scan for me. So I was actually in the hospital for surgery to correct the original issues that caused them to make this diagnosis. And as I was in the hospital being discharged, the oncologist spoke to me and said, well, we're going to need a PET scan, and we'll try and set that up as quickly as possible. It should take about 3, maybe 4 weeks to schedule that. And I said, wow, really, that long? And she goes, yeah, well, it's not really us. It's really the insurance company, because we have to get approval, and we have to go through a whole process, and we have people who do this all the time, so we know how to do it, but they're first going to suggest something else, and we have to come back with a counter, and so on and so forth. And I said, well, I just turned 65, I'm on Medicare, so maybe it won't take that long. And she kind of looked at me and said, well, yeah, it kind of really does still take that long. And I said, okay, so just to be clear, I'm not on Medicare Advantage, I'm on original Medicare with a supplemental plan. And she goes, oh, well, okay, in that case, I think we could probably schedule you a little faster. So it did get scheduled 4 business days later.
Wow.
So
thank God. You made some really good decisions.
You really can't ask for anything better than that. So, in terms of, I know the message that you're preaching about Advantage and versus original Medicare. My father-in-law is 91. He's on Medicare Advantage. He's hooked on the pre-premiums and the the Uber picking him up and all this and that, and it's all great until you actually get sick.
Right. Wow.
So I thought you'd appreciate that.
I really do. Thank you for telling me that.
Hundreds of stories like this that I have. Hundreds of stories like this. My neighbor, my relative, whoever it is that they know is on a Medicare Advantage plan had the worst experience, but thank you for telling me the difference between Medicare Advantage and Medicare Supplement. Anyway, even if you're on a Medicare Supplement, the cost of the drugs that go under Part D of your drug plan, to which there's no limit yet until 2025, can be potentially astonishing. Plus, the fact that if you do want to pay a family member to come take care of you, or pay for your travel to go to Johns Hopkins, Mayo Clinic, Cancer Treatment Centers of America, someplace in Mexico, if they've got some kind of experimental treatment, just to have an extra $10,000 or $20,000 to do with what you want, all you have to show is your record saying that you've got cancer, and you literally get a lump sum of cash to do with as you will. And by the way, it's tax-free. If you'd like to look into those options, there's no limit to do it. There's no time frame. There's no season. As long as you can answer about 5 health questions. Have you had cancer in the last 5 years? Yes or no? Have you had HIV or AIDS? Yes or no? Very limited health questions. Unfortunately, the state of California, in their infinite wisdom, has said that cancer insurance is not available to be sold or hospital indemnity after the age of 65. Absolutely insane. But hey, they're looking out for the consumer, right? So if you're in California, we can't help with this. Almost everywhere else we can. And this is a quick little website I put together so you can reach out, book a time, and we'll show you what the rates are. It's a very simple plan. You get cancer, you get cash. Do with it what you want. They're not paying providers. They're literally paying you. Everybody on a Medicare Advantage plan should have a cancer plan, especially if you're paying 0 premium for that plan and you've got the cash to pay for a $25 or $30 a month plan to take away that angst about what happens when I get cancer, and the majority of cancer diagnoses happen in the senior community. Please like this video. It'll really help us in the algorithm. And please comment below if you or anybody that you know has been struck by cancer or has gone through the rigmarole of the Medicare Advantage plan, and one of these things stood out to you, but you really didn't know that ahead of time. Please comment in this video. It could really help other people. Now, if you have a question about your coverage and you're a client of ours, don't comment asking a question about your coverage, because we can't get to them all in a timely enough manner to get you a question before you have to make a decision. So don't put a Medicare question about your policy with us in the comment, but I really want other people to benefit from your experience. So please do me a favor, like this video, and then leave a comment below on what your experience has been with any of these things. And for those of you that don't know, it's my obligation to let you know that most people won't. There are 2 ways to go with Medicare. I've just described things that you should look for a Medicare Advantage plan. However, there is an alternative that most people won't let you know. Go look at the Medicare and You guidebook that you get. It will talk about it briefly, and this is an excerpt from the Medicare and You guidebook. We have 2 ways to go. We have original Medicare, which is what you paid for and earned your whole entire life. And then we've got Medicare Advantage, which is literally a replacement for original Medicare. On both of these plans, you have to continue to pay your Part B premium every month. Someone just asked that today. If I do a Medicare supplement, Part B of Medicare, no, you can't, unfortunately, because this pays the other 20% that Part B does not cover. See, if you're on original Medicare, the only problem with it is it's got some great things to it. The problem is they're only going to pay 80% of your bills. So that's why a supplement kicks in here and then fills the holes. That's why they call them Medigap plans. But if you give up original Medicare and you sign up for a Medicare Advantage plan, please understand, most agents won't tell you this, but if you give up your original Medicare and a supplement option for Medicare Advantage, you may never again qualify for a Medicare supplement because you have to go through health underwriting to get one. That's why the Medicare supplement is the premier way to go, where you have no restrictions, you have no network. You can go to any provider that accepts Medicare, which is most everyone, from coast to coast and from sea to shining sea, without worrying about what hospital or whatever. You just go. Medicare Advantage, you're going to have doctor networks, provider networks at a service area, and you may need referrals, and you will have to have prior authorization before you spend their money. There are 2 ways to go here. And people say every day, I can't afford the $300, $400, $500 of a Medicare supplement plan. It doesn't cost that much. And if you're looking at rates and you only saw that, then you got it from a wrong source. We represent nearly every Medicare supplement plan in the entire country. And I've never in 26 years sold a plan that cost somebody starting off $300 or more. And your agent should, at least every 2 years, shop the market for you, because plans do go up. And you can redo that by going to another plan with another company. Same benefits, just a better rate. We do that all the time. For the visual folks, this is Medicare and Medicare supplement, paying all the bills automatically. Your doctor says you need it, it gets paid. This is the thing about Medicare Advantage, is their way that they get profit is by routinely denying care. I'll continue to bring you stories about that and proof. If you want a Medicare Advantage plan, you must sign up for one between October 15th and December 7th. December 7th is my birthday. It's Pearl Harbor Day. That's the end of our season. But by then, you should have chosen which way you want to go. You'll never hear from Medicare.gov or the folks at Medicare if you call them. Great people at 800-633-4227. You'll never hear them say a Medicare supplement might be something you want to consider. It's not even on their radar. They have no clue about Medicare supplements. That's why you don't hear from them. That's why you don't see TV commercials from Health and Human Services talking about you can sign up for a Medicare supplement 365 days a year. You can change your Medicare supplement 365 days a year. This window is only for Medicare Advantage. That's why, again, I'll encourage our clients, if you're on a Medicare supplement, please give us this window of time. It was only 54 days when it starts, so that we can help the Medicare Advantage plan, because they have a deadline and you don't. On Medicare supplement, you don't have a deadline. We can look at those plans for you all year long. But unfortunately, 99% of our clients only see the TV commercials from HHS and everybody else, Joe Namath, JJ Walker, Bill Shatner. It's a shame, really, saying you've got until December 7th to pick your plan for next year. If you're on a Medicare supplement, you don't. You don't have to do anything, but you can shop anytime you want to on a Medicare supplement plan. So we have this period of time, October 15th to December 7th, but we also have this period of time next year and every year from January to March 31st. During this period of time, you can switch Medicare Advantage plans. Let's say you had no idea they were going to change your benefits to this degree, and your plan, when you signed up for it a couple years ago, looks nothing like the plan that they stuck you with on January 1st, because you didn't see the annual notice of change and you didn't shop the market. A Kaiser Family Foundation study revealed that only 30% of the people look at their plans and what's changed every year. That should be a lot higher, but we certainly couldn't handle it if it were. But you should look at those plans and see what's different for the next year, and then affirmatively make a choice, especially those Medicare supplement folks of ours that are on the Part D drug plans. They're changing drastically this year. And again, the goal is to look at the total out-of-pocket cost. That's the only factor you should look at. And for Part D, you can use our tool, startpartd.com. Anyway, during the annual period of January 1st through March 31st, they call it open enrollment. It's not open. Neither this, it's not. This is like the disenrollment period, right? You can switch Medicare Advantage plans if you already have one, but you can't get one if you didn't get one already. So if you just rolled into one, or you join one and you find out, hey, my doctor just suddenly left, magically my doctor's gone. During this period of time from January to March 31st, you can change Medicare Advantage plans. Or if you're on a Medicare Advantage plan, we have hundreds of people still to call back right now as I'm making this video live. So many people calling us every day saying, I had no idea what you're talking about. I want a supplement. Tell me what I can do. We're trying to get back to absolutely every one of those people. But I'll tell you this, if you can't get off your Medicare Advantage plan or look at the options to do so before December 7th, then what you should do is find the best Medicare Advantage plan for the new year. Maybe it's staying on the same one. Maybe it's going to a site like MedicareAdvantageNearMe.com, our tool, and picking a different plan. Regardless of what you do, when January starts, you've got another period that begins there where you can drop your Medicare Advantage plan if you want to and go to original Medicare with a supplement. If you go to our website, seniorssavingsnetwork.org, which I don't have it on here scrolling, but if you go to our website, there's a place for Medicare help. And we explain exactly how that process works. You want to go from a Medicare Advantage to a Medicare supplement, you have to go through underwriting, and I explain how that works. So look at that. So the only way you can join a drug plan, by the way, this is misleading on the Medicare site. This is a page right from Medicare. What's it called? Medicare and You. It's been a long day. It's already dark outside, for crying out loud. You can only join a drug plan during the first 3 months of the year if you've dropped a Medicare Advantage plan. So the way you do it is you apply for a supplement, you get approved by the supplement, then you drop the Advantage plan by signing up for a Part D plan. If you did not get a drug plan or change your drug plan during this period of time, you're stuck. I'm sorry. The only time you have to change your drug plan is until December 7th. After that, the only way you can get a drug plan is if you're dropping an Advantage plan. I hope this has been of value to you. Please share this with anybody that you know that's on Medicare, that's either on an Advantage plan and don't really know what to look for next year, or they're considering the differences between a Medicare Advantage plan or a Medicare supplement plan, and they need to know it. You can scan that thing with your phone and get there to our website where we can help you, or you can call our number. If you could see it, there it is. And again, please be patient with us. Now we have people already calling us 3 and 4 times saying, I called you 3 days ago, you haven't called me back yet. That's because we've been upwards of 200 calls per hour coming in. It's not unusual. This happens every single year. But please use the tools that we have, which would be like our website, where it can answer questions for you and guide you to the right spot in our calendar to get you with the right agent licensed in your area, because we're nationwide. We help people in 47 different states. So we can help you. But again, if you're on a Medicare supplement plan, there's no reason to do a plan review right now. And it would be really in your best interest not to do a plan review during the annual election period, but to do that review December 8th until October 14th of the next year. Anytime during the year, we can look at, shop, change, join, drop Medicare supplement plans. This period of time of the end of the year is only for Medicare Advantage folks. And so far, there are a lot of them, like 26 million people are on Medicare Advantage. Half of them don't even know what they have. That's another study. I'll bring it to you if you don't believe me. I'm not just saying that flippantly. They seriously have no idea what they have because they're bamboozled into a plan. And that's what we want to avoid. Thank you so much for watching. God bless you. And please stay tuned for future updates about Medicare. And if you want to see the latest on this season and updates on Medicare, you can go to our website, seniorssavingsnetwork.org. And at the top of it, type in update. So seniorssavingsnetwork.org/update. You'll see videos as I'm putting them out there, new changes with companies, some companies being dropped out of the Medicare program. I'll actually mention their names so you don't get involved with them now. That would be a bad thing. Anyway, God bless you. We'll talk to you soon.